SIOG is an international multidisciplinary organization with a main goal of improving the care and outcome for older adults with cancer. And SIOG has three missions. The first mission is education. We want to educate healthcare workers, oncologists, physicians, but also allied health, nurses, physiotherapists, all people that are involved in the care of older people. Secondly, we want to focus on clinical practice. We want to develop tools to help healthcare workers to evaluate older patients. We want to make guidelines for clinical practice. So we want really to have as much information and knowledge to be spread out as possible. The third domain is research. We want to be a platform for research, to exchange ideas on research, and as such further improve the outcome and the care for older people with cancer. SIOG tries to achieve its goals by various activities. We have some core activities. One of the most important activities is the SIOG guidelines. So within specific domains, we try to generate very concrete guidelines. For instance, in the field of breast cancer, we had already 2 guidelines published in the Lancet Oncology, where we gather all the evidence available and then make very concrete recommendations on what is different in these older persons compared to younger persons. A second important tool for SIOG is the annual conference. It is a meeting with every year increasing attendance. This year we are more than 500 attendees. It's a 3-day course with a lot of sessions, side sessions, a lot of multidisciplinarity. All kind of specialists are sitting together to debate on the current knowledge and future projects for geriatric oncology. Another very important core activity is our journal. So SIOG is strongly related to the Journal of Geriatric Oncology. This is a journal specifically dedicated to cancer in older adults. It was established only 6-7 years ago, and it already has achieved an impact factor of 3.4 at this time. So this is really the way we want to get our message out. SIOG has several core activities, and one of the most important is the SIOG guidelines. So SIOG has established already 36 guidelines on the most important topics in oncology, with a specific focus on what is different for older individuals. And so this is always multidisciplinary, where we really gather all the information that is relevant for older adults, and we put it in very concrete recommendations that can be used in clinical practice for any healthcare professional involved in the care of older people. So the second was the annual conference. Yeah. The second core activity is our annual conference that we are doing since the year 2000. And every year we get more attendees, and now it's more than 500 attendees present. And this is really the heart of SIOG. We are sitting together in meetings. There's a huge amount of interaction between all the participants, and this is where a lot of new ideas come for research and for collaborations. A third core activity is the Journal of Geriatric Oncology. This has been established 6-7 years ago with the goal of really publishing all relevant research on this topic. And it has reached already an impact factor of 3.4 in only 6-7 years. So it's really, it shows that this is really an important domain and we want to spread the word through this journal. A fourth core activity is the Trevizo Advanced course. This is a very specific and peculiar course for young oncologists, young physicians, young geriatricians that are highly motivated. We restrict the number of participants to 30 only because we want to have very close interaction with the faculty. This is a 4 or 5 day course where there is very close education for these young people, and the goal is really that they, when they go home, that they also spread the message within their country or setting. Okay, and then did I forget? No, that was it. And then yeah, fifth. SIOG is also active in various domains, like the nursing and allied health working group, which is a working group of non-physicians, but who is also very active in seeing how they can improve care through improved nursing or other activities. And SIOG has a very, very active young SIOG working group. This is the most active young group that I've ever seen in international organizations. They are extremely helping. They are involved in guideline development, in e-tool development, and so this is quite unique for, I think. That's it.
On to the future plans.
Yeah. So for the future, one of the first goals of SIOG is that we want to expand our knowledge to all healthcare professionals in oncology. And the core goal of our society is that all oncologists become geriatric oncologists. Cancer is a disease that occurs in older people, and about half of the population is above 65 years old at diagnosis. So nearly all oncologists, all healthcare professionals dealing with cancer see a lot of older people. And so the principles that we are trying to develop need to be known by all healthcare professionals that are dealing with cancer patients. The second goal for the future is that we want to expand much more in local organizations, in international organizations that are not dealing specifically with cancer in older adults, because we believe that it's such a frequent problem that it should be a core activity in all these settings and in all these organizations. And the third goal for the future is that we should evolve much more to collaborations with governments, with academic organizations, with the WHO, the United Nations, because cancer in older adults is really becoming an epidemic problem, a huge problem, because of the demographic changes in the society.